Navigating the main screen buttons. Accessing the main screen. As the primary screen of MOVES SLC, the system will always return to this screen after a period of inactivity. The most recent software release allows for single button press changes between the setup screen and the main screen. To jump to the setup screen from the main screen, press and hold either back button. To return to the main screen while on any other interface screen, press and hold either back button. Alarm queue. The alarm queue is located at the top right corner of the main screen status bar on MOVES SLC. Rotate the jog wheel to navigate to the alarm queue, then press the jog wheel to activate it. Turning the jog wheel while the alarm queue is activated cycles through the alarms. Exit the alarm queue by pressing either of the back buttons. Some alarms can be dismissed, as distinguished by the Dismiss option shown in the top right corner of the alarm. To dismiss an alarm, press the jog wheel while the alarm queue is activated and the desired alarm is selected. Heart rate selection. MOVES SLC monitors heart rate in beats per minute with data automatically being generated from the first available source in the priority sequence of ABP1, ABB2, ABB3, SpO2, and ECG. An operator can also manually select a heart rate source. If MOVES SLC is auto-detecting a heart rate source, the button will display the text Auto. To manually select a source, use the jog wheel to navigate to the heart rate source button, then press the jog wheel to activate it. Turn the jog wheel to the desired source, then press the jog wheel again to confirm the selection. Charts and trends. The two graphs displayed on MOVES SLC's main screen can be set to real-time waveforms or trends. Use the jog wheel to navigate to a waveform or chart button, then press the jog wheel to activate it. Turn the jog wheel to view the options and select a graph or trends. When a graph is selected, the waveform will immediately begin plotting real-time data. The available graphs are ECG, arterial blood pressure, central venous pressure, intracranial pressure, pleth, airway, and partial pressure of carbon dioxide. If Trends is selected, a data source, data type, and/or time may also be selected. Available trends are fraction of inspired oxygen, peak inspiratory pressure, patient temperature 1 and 2, heart rate, arterial blood pressure, central venous pressure, intracranial pressure, non-invasive blood pressure, partial pressure of end-tidal carbon dioxide, oxygen saturation of hemoglobin, perfusion index, saturation percentage of carbon monoxide, saturation percentage of methemoglobin, total hemoglobin concentration in arterial blood, total oxygen content, and pleth variability index.